Doctors treat you differently when you're fat. I kid you not. I was treated so different when I was 104 pounds heavier than I am now by doctors. I will say my primary care is amazing. She's taking me seriously no matter what. But when I would go to doctors beforehand, they'd be like, oh, you need to lose some weight. They would brush off my other health issues, especially ER doctors. When I'd be in the ER, they'd be like, well, it's probably associated with your weight. And I'm like, no, there's something else going on. And it took me going to my naturopath. He figured out all my health issues that were not associated with my weight, but caused my weight gain and made it impossible to lose weight. That's why I went to get bariatric surgery after consulting specialists when I figured out my health issues. But the thing is, how they treat you is so pathetic when they treat somebody that's overweight. Like, overweight people deal with problems with their health that are not associated to their weight. So they should be taken seriously. We need to get to the bottom of these health issues and not just brush them off because, oh, they're overweight, that must be why. It is so infuriating that I'm treated so much better now, all because I've lost 104 pounds. Like, I was just as valid beforehand, and I think a lot of people go through this, and it's irritating. It's irritating.
Was I weight shamed by my doctor? I posted this story on Threads and I got eaten alive. For the past 60 days, I've been on my period and bleeding for 60 days. I feel horrible right now. I may not look it because I have a philosophy. Just because you feel bad doesn't mean you have to look it too. Monday morning, I'm feeling the worst I have in a very, 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 very long time. I'm getting ready for work. I can barely get my pants on. But I finish packing up my briefcase. I go to my car and my husband comes out and he's like, honey, you don't look good. And I tell him, you know what? I don't feel right. I am calling out. And he takes me to the emergency room. At the emergency room, they tell me, ma'am, there's not much we can do for you, but we can take your vitals and we can take a CBC. But we don't have an OB or a GYN. Isn't that crazy? In the United States, at most ERs and at most hospitals, there are no OBs or GYN. What do? They said you got to go see a GYN. Well, I'm new to Richmond, Virginia. I don't have a GYN here. I finally get one on the phone and they're able to schedule me for the very next day. Thank goodness. So the very next day was yesterday. I go in, facility's lovely. Everyone's super lovely. The doctor comes in. She seems really lovely. She hears all my symptoms, reads my chart and goes, I think you have a thing called anovulation. And I tell her, okay, I've heard of this before, but can you re-explain to me what that means in context of what's going on? She tells me what's going on. By the way, my husband is with me at this appointment because I take him with me to help advocate. I hate that that's a thing, but you know. And she goes, without me prompting, and usually what causes this is excess weight. And I'm like, oh, okay. Ma'am, I've had this issue since I developed my period when I was 12 years old, when I first started menstruating, and I was 115 pounds for a very long time. I was skinny. And she goes, oh yeah, well, you know, it does affect, thin women too, or smaller women too. And actually, to be honest, we don't really know what causes anovulation. I've been bleeding for 60 days and I'm in excruciating pain. The last thing that I care about right now is weight loss. I look over at my husband and I look at her and I go, you know, it's actually crazy. I've lost a substantial amount of weight. I'm actually on Ozempic for insulin resistance. Her whole mood shifts. She's like, oh, really? Well, have you noticed any improvement? Ma'am, I'm in here because I have been bleeding nonstop for 60 days. I've lost weight and it hasn't affected my cycle at all. And ovulation, when you look it up, that's weight or being obese is one of the bottom causes. One of the top causes is actually over-exercise and anorexia. But yeah, I'm pretty sure I got fat shamed by my doctor. And to everybody on Threads who said that I'm an idiot and that fat people just don't want to listen to health advice, I'm sorry, excuse my French, bleep you.
I want to talk about what it's like going to the doctor as a fat person. Hello, doctor. I'm here today because I've hurt my back. Hello, fatty. I see here that you need to lose weight. While it may be true that I need to lose weight and you have prescribed me medication to lose weight, I am actually here because my back hurts. Look, fatty, I'm looking at your chart. If you would only lose weight, your back wouldn't hurt. Okay, but I can't actually lose weight right this second, and right now my back is actually in pain. Is there something that I should be doing or that you can help me with? Again, if you only lost weight, your back wouldn't hurt. Is there someone here that I can talk to? Is there someone I can make an appointment with? Because right now my back actually hurts pretty badly. So I was wondering if I could get some help.
As a fat person, I often dread medical appointments because of blatant medical fat phobia. The last OB appointment I went to, the provider blamed everything on my weight and told me that I needed to go on a medication. This OB appointment that I just went to, I've been dreading, and the provider was amazing. She asked me what my pronouns are. She asked me about my name. She just was like, great.
This is for all my curvy ladies out there who ever had to go to a doctor for anything. I recently made a video about how I needed to get a new gynecologist because my last gynecologist would always find reasons to talk about my weight, even though that was never what I was there for. So I found a new gynecologist, finally, and waited only a month to get this appointment because, in America, thanks to not having universal health care, there's no wait times. Not even for emergencies. So anyway, background on this new doctor. I didn't know anything about her, but I did some research online, and she had pretty good reviews, and she was a bigger woman, so I thought, perfect. But I wouldn't be making this video if it was perfect, would I? So when she walked into the room, the only thing she asked me was why I was there. I told her, and then she immediately jumped into her spiel. She immediately suggested gastric bypass, or Ozempic. If you don't know what Ozempic is, it's a diabetes shot. I don't have diabetes. And what the shot does is it makes you sick, so you don't want to eat. And that's how you lose weight. It makes you sick, and that's how you lose weight. She said, oh, we just had this obesity conference in here, and the obesity guru said that the best way for a woman to lose weight is gastric bypass. After she talked at me for about 15 to 20 minutes about her opinion on my weight, she asked my thoughts on it. I said, I don't want any of that. Take note, she did not ask me if I was trying to lose weight, if I was interested in losing weight, nothing. She just automatically input her opinion. She said that she herself had done Ozempic for about 3 months and she lost 12 pounds. 3 months worth of being nauseous to only lose 12 pounds? What she didn't do was ask me whether or not I had been trying to lose weight. I have been. It's nobody's really business to know about whether or not I have been, but I'm going to put it out there. I have been. I've lost 25 pounds. You know what I didn't have to do? Get sick to do it. Didn't have to have surgery to do it. When I told her that I thought that gastric bypass was a little extreme and I could just do the diet and lose weight because that's the whole concept, she was like, oh, I know. These scientists are claiming that this is the best way to lose weight, but really, what about the complications? And I'm like, lady, you just said that they were gurus and that was their suggestion that it was the best option. She also suggested that I get an IUD. I did not ask for any birth control. I did not ask for an IUD. So really, I have a question. How much are doctors getting paid as bonuses to push the pharmaceuticals and the procedures and everything like that? How much are they getting paid? Because this happens every time I go to a doctor. I want a cut. You're going to talk to me about it. Give me a cut.
If you're a fat person and you go to the doctor, you already know what they're going to tell you. They're going to tell you that you need to lose weight. Even if you go for something that's not related to your weight at all, like a migraine or a broken arm, they're still going to tell you that you need to lose weight, which definitely sucks. So today, I went to the eye doctor to check on my eyes because I need new glasses. He asked me about my medical history. I tell him that I have no existing medical conditions, so I'm healthy. And he then tells me, I don't know if anyone has ever told you this, but you need to lose weight. He then goes on by saying that if I don't take care of my body, I might get diabetes, and that's definitely going to affect my vision. What the fuck? This is the first time meeting this doctor. This is the first time meeting each other. And he thought it was appropriate to tell me you should lose weight. For an eye exam? What the fuck? And listen, before anyone comments, I do know that weight can affect your health and body. And that certain medical conditions can affect your vision. That's why he asked me about my medical history and if I had any existing medical conditions, which I don't. I don't have any type of medical conditions. I understand that. But for him to assume that I might get diabetes because I'm fat is completely uncalled for, unprofessional, and inappropriate, especially since this is the first time meeting each other. Like, this is the first time meeting this doctor, and this was supposed to be a routine eye exam. Just a checkup for my eyes because I need new glasses. Nothing else. So yeah, after that it was awkward, and I just wanted to get the whole thing over with. I just wanted to do the eye exam, get my prescription, and pick out new glasses. That's all I wanted to do. And I'm definitely going to be changing doctors after this.
My name is Jonna, and I am a plus size girl who has chronic pain. I'm just going to be blunt. Going to the doctor is like one of my biggest fears of all time. But my hip pain has reached a point that, like, it's not bearable. Like, I don't want to get emotional. It's bad. It's really painful. So I am now back at the doctor who low-key kind of traumatized me 4 years ago. That specific doctor doesn't work here anymore. It's just an orthopedic clinic. I already know what they're going to say. They're going to be like, you're fat, lose weight. And to that, I'm going to tell them I am taking a GLP-1, which I'm not yet, but I am planning on it. I am going to. I've decided I'm going to pull the trigger and do it. Right now, my hope is just to go in there and get maybe like a referral to a physical therapist because my shit hurts. Also need to set up an appointment with my primary care doctor so I can, for real, get on that GLP-1 because, yeah, it's time. It's time. Anyway, wish me luck in this doctor. I'm getting nervous as fuck. And I don't know. I just don't want, I want to make sure that I advocate for myself and stand my ground on what I want and don't let them just like bully me into talking about bariatric surgery like they did last time. So, wish me luck.
For many people, going to the doctor is supposed to feel safe, but for fat patients, it often feels humiliating, dismissive, and emotionally damaging. In this video, we talk about what it's really like being fat at the doctor's office, from being blamed for every symptom to not being taken seriously, denied proper testing, or shamed instead of helped. This isn't about refusing responsibility for health, it's about medical bias, fatphobia in healthcare, and how these experiences traumatize people and push them away from seeking care. Before you even explain your symptoms, your body has already been diagnosed. Headache, lose weight. Stomach ache, lose weight. Fatigue, depression, hormonal issues, lose weight. It often feels like doctors stop listening the moment they see your size. Many fat patients talk about being weighed publicly, giving unsolicited diet lectures, or having serious symptoms brushed off as just weight-related. Some are denied proper tests, others are shamed instead of helped. Over time, this creates fear. Fear of appointment, fear of asking questions, fear of being honest about pain. And the worst part, this treatment doesn't just hurt feelings, it delays diagnosis. People avoid doctors altogether because they don't want to be embarrassed or blamed. Conditions get worse. Trust in healthcare breaks down. And that's how medical bias becomes dangerous. If you've ever felt unheard or dismissed by a doctor because of your body, please share your story in the comments below. Also do well to subscribe, like, comment, and share.
If you are obese, please don't ever let a doctor or a healthcare provider tell you that you need to lose weight before they investigate further a symptom that you're having. If they want to delay getting a lab or getting imaging or having you see a specialist, if they want to delay that because they say you need to lose weight first, you need to push back on that person. Or you need to find someone else. Because your health problems are not just blamed on your obesity or the amount of fat tissue that you have. You are allowed to have other health problems as well, and you deserve the respect and dignity of investigating those other symptoms as well.
If you're a thin healthcare provider, I want you to stop and listen. I guarantee you don't understand how your fat patients feel when they walk into the office and see you. They don't know what kind of care they're going to get. It could be weight neutral, very accessible care, or it could be the medical standard. This is one of the reasons that people in larger body avoid going to the doctor, because they don't want to get some sort of diet and weight loss conversation when they're in their office for, say, strep throat or sprained ankle. This is actually one of the reasons why people in larger body avoid going to the doctor, and sometimes conditions can be worse once they get there. And then what do you know? They're blamed once again for having the problem based off their weight, when really they were just trying to avoid weight stigma.
I was going on my chart to find what vaccine I got last time because I couldn't remember. And on there it says concerns for appointment. Yeah, she did say severe obesity. excuse me, severe obesity. I'm 260 pounds.
No, that's not dramatic. That's actually pretty accurate. When a doctor writes down severe obesity, they're not insulting you. They're writing down the obvious problem. Somewhere along the way, people have decided honesty equals hate. It doesn't. Doctors aren't there to protect your feelings. They are there to protect your life, essentially. If your chart says severe obesity, that's not a personal attack. That's your body waving a big red flag telling you it's probably time for a calorie deficit. Here's the truth. The body positive culture has trained people to see truth as hate. So instead of you fixing the issue, you get offended by a label. The reality is you do not get healthier by arguing with the doctor's diagnosis. You get healthier by facing it.
I went to my yearly physical and the doctor told me I was obese. She flat out told me within the first 30 seconds of coming into the room, you're obese. And I was like, okay, Miss Ma'am, run my insurance and get me that Zepbound. And insurance came back and said, you are declined. And so I was like spiraling because if you guys know, I struggle with my weight. We've struggled with gluttony, okay? But that's a story for another day. And we rebuke that in the mighty name of Jesus. But I have struggled with food noise and inflammation and cravings and binge eating. And so for me, I'm just tired. I'm sick and tired of being sick and tired. And I'm tired of looking inflamed, feeling inflamed, and just not feeling like myself. I used to be extremely heavy, and then I dropped down 30 pounds and looked the best I ever looked about 2 years ago. And then slowly out of nowhere, I woke up and I was like, where did all this weight come back from? And here I am. And I'm just going to be honest and open on my page because why would I lie? I'm sure there's a ton of people that are doing this and pretending like they just started a regimen and started going to the gym and it just miraculously fell off. I struggle. I'm going to keep you guys in the loop of this struggle and how I'm gonna overcome it. I went online, I did a bunch of research, I came across Freya Meds. I took a quick quiz, figured out that I could do this, get on this injection, trizepatide. Took me all of 5 minutes. The doctor was so quick to get in response with me, and now I have a monthly fee that I'm going to pay, which is super affordable since I will not be covered by insurance. I took my first injection on Monday. Danny refused to do it, so I did it myself and I struggled a little bit.
Hey, calm and go. Can you just do it? No, I don't think I'm allowed to. I see other people getting injected by people doing this. I don't know. I'm not trying to get you in trouble. You're going to nursing school. I'm not touching it. Danny, shut up! Ooh, okay. I'm gonna just do it. Do it! I did it. It wasn't even bad. I don't know why I was freaking out. That didn't even hurt. Like, what?
I did all that panicking, and I should get over that because I'm going to be a nurse, but I feel like it would be easier to inject someone else than it would be myself. But when I did it, I was like, what was I scared of? You know? I feel absolutely wonderful. I'm already down 1 pound and 6 ounces. It hasn't even been a week. Tomorrow will officially make a week, so we'll see where I'm at tomorrow. I did not weigh myself this morning. I refuse to weigh myself every day.
Just went to the dermatologist. As you can see, I saw a spot come up on my face last week, and I was like, this is not normal. This looks abnormal. I got to get into the dermatologist right away. That's what I did. Today I got in. They're like, yep, not normal. They shaved it off. It's out for biopsy, and we took care of it, and we're taking all the necessary steps that we need to. But I couldn't help to think about while I was laying naked on a paper mache sheet and had my little paper mache vest on, how vulnerable it is to do that, especially if you feel uncomfortable in your body or feel shame in your body. I felt like, hey, if I gotta wear this patch on my face today, I might as well make a PSA that please go get your skin check. Please, please, please make your biannual or annual dermatology appointment, because not going due to shame that you feel about your body size is only going to be detrimental to your health in the long term. And I'm also here to tell you that if you are not going because you know your dermatologist is fatphobic or they've made comments about your weight, 1, we can either get a new dermatologist, or 2, you can set boundaries that advocate for yourself to say, hey, we're not going to talk about weight at all in this appointment. I also have a really great colleague of mine, Dr. Asher Larmy, that founded No Way, that's WEIGH.org, noway.org, that has a little business card that you can hand to a medical professional that says, hey, I do not want to be weighed. I don't want to talk about weight. And it does that for you, so you don't even have to set that boundary. Please, please know that putting off medical care, skipping doctor's appointments is only detrimental to your health. And I'm saying this because as someone who used to be petrified to be naked on a table, I think about, well, what if I wouldn't have gone to the dermatologist because I was so scared about my body? Meanwhile, this needed to go. So if I can encourage just one person to make one doctor appointment that they've been putting off due to shame they feel about their body or the fear of what could be said, then it was worth it. And if you have questions or comments that you want to leave below of, okay, I'm going to make the appointment, but I need support here. Let me know how I can help you so you can feel confident going into your doctor appointment.
And listen, this isn't about refusing responsibility for health. It's about respect. Fat people deserve the same care, curiosity, and compassion as anyone else. Weight should be one data point, not the entire diagnosis. Until doctors learn to treat fat patients like humans first, the doctor's office will remain a traumatic place for many people who simply want help. Healthcare should heal, not harm. No one should leave a doctor's office feeling ashamed of their existence. Listening saves lives, and empathy is just as important as medicine. Thank you very much for watching. If you love this video, please do well to subscribe, like, comment, and share. Thank you, and see you on the next one.